We are Healthcare Learning Innovations, the virtual leader transforming nursing education. We believe there's a new way to take on the problems nurse educators, college deans, human resources teams, and students are up against. That by creatively leveraging technology and advanced educational methodologies, we can address critical learning issues, regulatory and cost pressures, and improve learning outcomes. While we are obsessed with education, we also don't assume we have all the answers. We listen to nurses, nurse educators, and students to understand what they need and what they want. Then we develop e-learning solutions that integrate with nursing courses and healthcare education programs. Our award-winning virtual clinical simulations and scenarios cultivate critical thinking and the observational and communication skills nurses need to be awesome caregivers. They're great for various nursing courses, capstone projects, new nurse residency programs, and more. And offer anytime, anywhere management and leadership training too. We can even create products customized to your program. For us, success is all about giving nurse educators the tools they need to nurture great nurses and to advance virtual simulation in nursing education. That begins with Sentinel City and Sentinel Town. These virtual clinical simulations transport the learner to urban and rural environments. Learners explore at will, document observations, and communicate with the people who live there, just like any real community health nurse would. There are also 40 assignments designed to help teach community and population health issues, like disaster preparation or infection and disease prevention. After a few visits to Sentinel City and Sentinel Town, learners understand significant community, public, and population health concepts. They gain meaningful clinical experiences without risk, earning simulated clinical hours along the way. Healthcare Learning Innovations also offers a rich portfolio of virtual clinical scenarios that enable students, new nurses, and nurse practitioners to practice critical thinking and leadership skills. In our patient management and delegation scenario, the learner acts as a charge nurse. Learners assess patient acuity, schedule nursing staff, delegate appropriate tasks to a nursing assistant, and prioritize care. It's a window into the dynamic world and complex decision-making and clinical judgment that a charge nurse encounters every day. This scenario is perfect for undergraduate nursing leadership courses or hospital nurses preparing for management roles. Our ED-based scenario, Prioritization of Care, contains 9 skill categories including cardiac, respiratory, neurology, genitourinary, peds, mental health care, and more. Learners go through levels of increasing difficulty, meet 40 unique patients, assign them to a level of care, and then prioritize the order they will be treated. Rationale is needed to support decisions, and remediation is provided immediately. In response to our customers' feedback, we created a clinic-based scenario, Prioritization of Care 2, with new in-demand skill categories, settings, and achievement badges. In this scenario, there's a significant focus on mental health, psych, drugs, alcohol, and women's health patients. Learners meet 50 diverse patients and progress through 5 levels of increasing difficulty. The goal is to teach evidence-based decision-making and to respond with the right course of action across a range of situations. Our family support and home assessment with care plan virtual clinical scenario takes learners into a public health department facility to interview a single mother and then into her home. It helps learners practice psychosocial assessment, charting, and care planning virtually before venturing into potentially risky environments in person. It's an exciting time for nursing education. Yes, there are challenges for nurse educators teaching in community colleges and nursing schools, as well as hospital education leaders, such as finding and managing meaningful clinical placements, providing an environment where learners can practice decision-making and master critical thinking risk-free, engaging students, new nurses, and rising nurse managers with gamified learning, and giving nurse educators and healthcare training managers affordable tools to better educate more students and nurses. There also is Healthcare Learning Innovations. We know that through reliable innovation and our drive to develop lasting relationships within the nursing community, we can overcome these challenges together. Are you ready to become immersed in a whole new world of nursing education? Help the nursing community reach our common goals? Join in the transformation of nursing education.